Hi all. Today I am here to tell something about the endocrine disorder hyperthyroidism and the crucial role that diet and lifestyle play in its management. So hyperthyroidism occurs when the thyroid gland becomes overactive and produces excess thyroid hormones. This can lead to a hypermetabolic state in the body. So it causes the symptoms such as fatigue, weight loss, sensitivity to cold, depression, memory problems, goiter, hair loss, muscle pain, trembling hands, infertility, such symptoms. The most common cause worldwide is the grave disease. It is an autoimmune condition. Here, the medical management can be hyperthyroid, anti-thyroid drugs, iodine, iodine therapy, surgery. It is the mainstay, but dietary choices and lifestyle modifications are the powerful supportive tools. So, a well-planned diet can help reduce excessive hormone activity and prevent the complications like osteoporosis and muscle wasting, and can improve the quality of life. Similarly, some stress reduction, adequate sleep, such we can discuss later. So here we will explore the recommended foods, those that should be avoided, and the lifestyle practices that help patients with hyperthyroidism leading healthier lives. So we can start. What are the food to avoid? As we use iodized salt for these hyperthyroid patients or persons, they should not use this iodized salt. They should use non-iodized salt because it can worsen the thyroid hormone production. So iodized salt, seaweed, shellfish like shrimps, such things should be avoided. Then next is caffeine. Our favorite thing is coffee, then some excessive tea, such should be avoided. Another main thing is processed food. These processed should be avoided because it can cause inflammation and your condition will be aggravated. Next is the gluten. In gluten, it will include the bread, baked goods like crackers, biscuits, such things, then pastas, cereals, soups. In some soups, gluten will be there. Then this beer is mainly made up of barley and wheat, so it can contain gluten. So it should be avoided. These things should be avoided because it can increase the inflammation. Graves disease will be aggravated, so it should be avoided. Then we will think what we can use. Here what we can use is main is cruciferous vegetables, that is cabbages, cauliflower, then broccolis, etc. We can use. Then another thing is anti-inflammatory food. Anti-inflammatory foods like garlic, ginger, turmeric, it can be used. Then another is protein rich. What are the protein rich foods? This omega 3 fatty acid like small fishes, eggs, beans, tofu, that are things you can use. Then whole grains like oats, brown rice, like this, brown rice, whole wheat, millets, such things you can use. Another thing is fruits. In that what we can use is especially berry items, apples, pear, papaya, watermelon. These things can be used. Then dairy, if we want we can use yogurts, but curd, milk, such things, if you are using means you can use, but just reduce the amount. Then water is the main thing. You must stay hydrated. 2 to 3 liters water per day you should use. Then main important one thing is you should take calcium and vitamin D supplements. It is a very important one. because hyperthyroidism can cause weakening of bonds. So here, if we take these supplements, then weakening of bonds will not be there. Your bonds will be strong. For that, you should take this. Then another thing is magnesium and omega-3 fatty acids, like small fishes. As I told, small fishes can be used for that. Now we can look into lifestyle modification. Lifestyle modification. The main important thing for hyperthyroidism or hypothyroidism or Hashimoto's thyroidism, anything, if you have any thyroid disorder, you must have some adequate sleep. How many hours? 7 to 8 hours of sleeps. Avoid late nights. Cut screen 1 hour before before sleep. 1 hour before sleep, no phones. It should be in your mind. Another main thing is exercise. Moderate or gentle exercise. But avoid very heavy and intensity, high intensity. High intensity workouts. Then another one good thing is yoga. Yoga is best for stress management. You can do some deep breathings, etc. can be used. Yoga you should use for stress management. Another one main thing is smoking and alcohol. It should be avoided. No, say no to this. If you feel like it is the symptoms reduced, or if you want to check, means you can check for every 6 months. So now what I am going to do is, if you want, I will give one day like timetable, like I can give, like morning, if you if we after some workout, you can go for, first is workout, second you can go for warm water in that soaked chia seeds you should take. Then if you want, it's optional, if you want, you can take 1 to 2 almonds. It is best. It is optional only. If you want, means you can take. Another thing is, next is breakfast. As I told, you can take like oats or upuma. In that you should include cauliflower, beans, carrots, etc. Or ragi dosa. In that use rock salt, no iodized salt. It should not be used. Rock salt is the main. You can use rock salt. Then another thing is, you can use some papaya or guava or apple. You can use 2 to 3 slices. Then if you want in between some snacks, means you can go for some cucumber, carrots, or same this apple, guava. You can use these in on 10 to 11 am, like that you can use. Another is lunch you can use like brown rice. You can add cabbage, cauliflower, broccoli, beans, carrots, etc. Then some poriyals, something you can use. as you eat you can use, but avoid what I told above. You should avoid that, but use such things, cabbages like that, and use rock salt, never use iodized salt. Then next is evening snacks. You can use roasted chana, sprouted legumes. In that you can use some onions, carrots, etc. If you want to have some tea means you can use some herbal teas. It is good. Night you can have some soups, cabbage thoran, some sambar, rasam, dosa, idli. You can use that. No problem in that. And last one is at night you can use 1 cup turmeric milk. It will reduce the inflammation, decrease inflammation, so you can, it will help a better sleep. That's the main of this. So as I told, exercise is very much important. Yoga, meditations, like some mood stabilizing things, like if you have stress management, it is better, so you can use that. Have some yoga, go out, refresh yourself, you can do that. So lifestyle modification, even if you have some medications, you, if you feel like it is not much useful for it, better you concentrate your lifestyle. You must change your lifestyle, your eating habits. If you do such things, your life will be easier and it will be better and you can shine more. Thank you.